Hi, my name is Shamika Jones, and I am the Infection Control Nurse at Caring Health Center, your local community health center in Springfield, Massachusetts, where we continue to provide quality care services to the community. Today I want to talk to you about the coronavirus, also known as COVID-19, and how our health center can help you stay safe and healthy during this time. We know that you are already informed a lot about this virus, but we believe that it is even more important for us to remain alert and vigilant in order to be safe and secure at all times. So let's start talking about this virus. First of all, it is very important to know what is coronavirus. The coronavirus, sometimes called COVID-19, is a respiratory illness that can spread from person to person. The virus has recently spread from person to person in many parts of the world, including the United States, and it continues to spread today. The virus spreads between people who are physically close to each other, within 6 feet, or who touch the same surfaces. When they cough or sneeze, their germs get in the air on other surfaces, and this means that it's very easy to contract coronavirus or to pass it to someone else. So who is at most risk for coronavirus? People who are 65 and older who have chronic health issues are at most risk for serious complications. Examples of people who have serious chronic health issues and are at risk for coronavirus include people living with diabetes, hypertension, heart disease, cancer, HIV/AIDS, and autoimmune diseases. People who have compromised immune systems or who take medications to suppress the immune system are at increased risk. People who have respiratory illnesses are also high risk for coronaviruses, including people living with chronic obstructive pulmonary disease, also called COPD, and asthma. Pregnant women are also considered at high risk and must take special precautions to protect themselves from the coronavirus. Sometimes the conditions in which people live or work can increase the chance of getting coronavirus. For example, people who work in healthcare, grocery stores, gas stations, food services, and restaurants, or transportation, like Uber drivers, they need to take special care to protect themselves. People who live in shelters, nursing homes, and other group settings are also at risk. Additionally, people who live in multi-generational households or with multiple families can also be at increased risk. For example, homes where the grandparents and grandchildren all live together. What are the symptoms of coronavirus? Not everyone with coronavirus will have symptoms, but those who do may experience coughing, runny nose, fever, difficulty breathing, body aches, nausea, diarrhea, loss of sense of smell or taste, and confusion or disorientation. Some people experience serious complications like pneumonia or even death. So what should you do if you have symptoms of coronavirus? If you feel sick, please stay home and away from other people. Call your health center or primary care provider right away. Call us at Caring Health Center at 413-739-1100. It's important that you call first before coming in. You'll talk to a nurse who will let you know if you need to come in, or you can talk to your doctor on the phone. This is called a telehealth visit. If you need help with this, a member of your household can make the call or join the visit with your permission. Telehealth visits help keep you away from other people, which reduces the risk of you contracting coronavirus or giving it to someone else. If you are having trouble breathing, call 911 right away. Let them know you are experiencing COVID-19 symptoms and will do what they say. So what can you do to protect yourself and others against coronavirus? There are several important things you can do to protect yourself and others from this virus. You might hear the term quarantine, social isolation, or self-isolation. This means you should stay home, away from other people as much as possible. When you see your friends, try to stay at least 6 feet away and don't touch each other. 6 feet is like 2 arm lengths apart. You should only go into public spaces for essentials, like shopping, groceries, going to the doctor, or picking up medications at the pharmacy. If you have to go into a public place, wear a mask and gloves and wash your hands before and afterward. If you don't have a mask, you can wear a scarf or bandana around your mouth and nose. If you need to shop for food or medicine at the grocery store or pharmacy, stay 6 feet away from other people. Follow the signs and directions provided in supermarkets and pharmacies. These are in place to keep you and others safe. Consider whether you can order items to be delivered to your home instead of going out. At least 63% to 70% alcohol. Most importantly, do not touch your eyes, nose, or mouth without washing your hands first. Avoid close contact with anyone who is sick. If you are sick, stay home. If you're sick, cover your cough with your elbow or sneeze with a tissue, and then throw the tissue in the trash. Wash your hands each time. Clean and disinfect surfaces that you touch. If you feel sick, stay away from other people and call your health center or primary care provider. You can always call us here at Caring Health Center. If your systems are working quickly or you have a shortness of breath, call 911 and do what they say. Is there any treatment for COVID-19? At this point, there is no treatment yet for coronavirus. People with coronavirus can seek medical care to help with their symptoms. Vaccines for coronavirus are currently being developed and tested for future use. So let's talk more about social distancing. What does it mean for you? Social distancing means that you should avoid close contact with other people. If you are sick, you can help stop the spread of disease by social distancing. If you are healthy, you can help prevent yourself from getting sick. Stay at least 6 feet away from other people. Do not gather in groups of more than 10 people. If you work, try to work from home whenever possible. If you are a student or parent, talk to your school about options for distance learning or studying from home. It is very important to stay out of crowded places and avoid large gatherings, like birthday parties, religious services, or church, baby showers, or funerals. Unfortunately, this is not the time to gather with friends and family. Although we all love to see our friends and family, we must avoid going to other people's homes, restaurants, parks, shops, or any other places unless absolutely necessary. This means that we must not invite friends or family over for dinner or arrange play dates for our children. When we do see our friends and family, we must not hug them, kiss them, or shake their hands. This may feel strange, but we must avoid touching other people so that we don't cause our friends and family to become sick. What if you're a caregiver? Many of us take care of our parents, grandparents, or children, or disabled friends and family members. It is important that you and the person you are taking care of wear a mask. If they are unable to wear a mask because it makes it hard for them to breathe, you should wear a mask. Avoid touching the person you are taking care of if possible. If not possible, wash your hands before and after touching them and be sure to wear gloves. Avoid having visitors. For example, don't invite friends and family over to visit your loved one. So what if you're an immigrant? Will seeking testing and treatment make you a public charge? No. United States Citizenship and Immigration Services has said that it will not consider testing, treatment, or preventive care, including a vaccine, if one comes available, related to COVID-19 in deciding whether an applicant for a green card is likely to become a public charge. If you are an immigrant without a green card, you can still receive health care. Contact your local health community center for help. You can always call Caring Health Center at 413-739-1100. In Massachusetts, testing and treatment for COVID-19 is available free of charge for most low-income residents, regardless of immigration status. If you are experiencing an emergency and need immediate medical care, go to the nearest hospital or emergency room or call 911. Many people are having a difficult time right now. Some people are worried about becoming sick. Some people are struggling because they've lost their job, can't get out to the store or go to the doctor, or having a hard time managing their children at home. Some children are having a hard time without the normal structure or school or childcare. If you're feeling sad or worried, you are not alone. We are here to help. You can make an appointment with a therapist or a counselor to talk about how you feel. Call Caring Health Center at 413-739-1100 and ask for the Behavioral Health Department. If you're struggling with social needs, we can help with that too. Social needs refers to access to food, housing, transportation, education, legal assistance, and other resources that can affect your health. If you're struggling with any of these issues, call us at Caring Health Center at 413-739-1100 and ask to speak to a benefits navigator or community health worker. You can also visit www.413cares.org to find local resources to help you and your family. Lastly, if you are feeling sad or worried, you are not alone. We are here to help. Other services we offer are medical, adult, and pediatric, urgent care, behavioral health and emotional wellness, substance use treatment, dental, sexual and reproductive health, pharmacy, health insurance, SNAP, nutrition and WIC, chronic disease management. Call us at 739-1100 or visit us at www.caringhealth.org. Other resources that are available to you are Springfield resources at www.413cares.org. For Massachusetts resources, www.hcfama.gov. www.miracoalition.org/COVID-19, and for immigration and public charge, www.miracoalition.org/PIF. We hope that the information presented in this video will be useful for you. On behalf of the Caring Health Center and myself, I express many thanks to you for your valuable time. May you all be safe and healthy.